couldn't have been bigger than the, you know, sort of spiritual pain. And I felt that that was a very small thing to go through compared to the actual big picture. So to me, you know, I didn't feel the pain, and I felt it was a necessary step to go through, because, you know, the baby was alive and the baby should have been born the normal way. So I think it was the right thing for me.
A fatal fetal anomaly refers to a severe and often life-threatening medical condition or structural abnormality detected in a developing fetus during pregnancy. These anomalies are usually identified through prenatal screenings or diagnostic tests. They are conditions that are not compatible with the baby's survival, either because they are not viable outside the womb or because they would result in a very short life with significant suffering, first 28 days of life. Approximately 2% of pregnancies are diagnosed with a congenital anomaly each year. A proportion of these anomalies will be lethal or fatal, and congenital anomalies remain the leading cause of fetal death and child mortality. The most common cause of the congenital malformation is idiopathic. That slide shows the most sensitive periods for teratogens in pregnancy. Incidence of congenital fetal anomalies and fatal fetal anomalies, FFA. Approximately 2% of pregnancies are diagnosed with a congenital anomaly each year. Approximately 15% of pregnancies with congenital anomaly are fatal fetal anomaly each year. Fetal Assessment Units, Statistics in Letterkenny University Hospital, 2022. Content warning. That slide contains a graphic image that might be traumatic for some viewers. Please exercise caution and self-care when watching this slide. Examples of fatal fetal abnormalities. Anencephaly, partial or complete absence of the brain. Congenital anomalies remain the leading cause of fetal death and child mortality. A diagnosis of fatal fetal anomalies can result in an intense grief reaction for parents, which can be exacerbated by inadequate care and support. The impact of a FFA on a family can be profound and complex. It often involves emotional, psychological, and even physical challenges. Emotional distress, shock, sadness, anger, grief. Difficult decisions, whether to continue the pregnancy, seek medical interventions, or terminate the pregnancy. Each decision comes with its own emotional implications and moral considerations. Impact on relationships. Strain relationships between partner. Open communication crucial. Impact on siblings. Parents may need to find ways to explain the situation in an age-appropriate manner. Support needs. Families require comprehensive support from healthcare professionals who are knowledgeable about FFA. Diagnosis of fatal fetal anomalies must be timely and precise, with the input of tertiary center when indicated, and multidisciplinary team input is mandatory. Methods of diagnosis for fetal anomalies: routine prenatal screening, maternal blood tests, for example, triple or quad screen, initial ultrasound examinations, advanced ultrasound, detailed ultrasound examinations to identify structural anomalies in various organs, invasive prenatal testing, amniocentesis, sampling of amniotic fluid for genetic analysis, chorionic villus sampling, CVS, sampling of placental tissue for genetic analysis, cell-free DNA testing, non-invasive prenatal testing, a method that analyzes fragments of fetal DNA in the maternal bloodstream to detect chromosomal abnormalities. Fetal MRI, magnetic resonance imaging, specialized imaging to provide detailed information, especially for brain and spinal cord anomalies. Genetic counseling and genetic testing, assessment of risk factors through genetic counseling. Genetic testing methods, including but not limited to whole genome sequencing. Consultation with specialists. Evaluation and consultation by pediatric specialists, such as cardiologists, neurologists, or geneticists. Serial ultrasound monitoring. Repeated ultrasound examinations to monitor the progression of known fetal anomalies or gather additional diagnostic information, including cell-free DNA testing in the list, highlights a non-invasive method for detecting certain fetal anomalies by analyzing fetal DNA fragments present in the mother's blood. A team of healthcare professionals, including obstetricians, neonatologists, nurses, social workers, chaplains, and counselors, collaborates to provide comprehensive care tailored to the family's needs. Sonographers' role in dealing with fatal fetal abnormalities. Sonographers play a crucial role in proving care and support to families facing fatal fetal abnormalities. Early detection allows for timely medical interventions and decisions. With their deep understanding of fetal anatomy and normal development, sonographers can accurately identify any deviations or irregularities in the baby's structure or organs. Compassionate communication. Approach families with empath and sensitivity, recognizing the emotional impact of the situation. Use clear and understandable language when explaining the diagnosis, avoiding medical jargon. Education and information. Ensure families understand the diagnosis, the implications, and the available options. Provide written materials or resources that families can take home for further reference. Privacy and comfort. Create a comfortable and private environment for families during scans and discussions. Allow families time to process the information and ask questions. Collaboration with healthcare team. Work closely with obstetricians, genetic counselors, and other healthcare professionals to ensure coordinated care. Share diagnostic findings and observations accurately. Non-directive counseling. Offer non-directive counseling, which involves presenting all options without influencing the family's decision. Respect the family's choices and values, even if they differ from your own beliefs. Follow-up support. Provide information about support groups, counseling services. Offer contact information for further questions or concerns after the appointment. Cultural sensitivity. Be aware of cultural and religious considerations that may influence how families process and respond to the diagnosis. Tailor your approach to respect their cultural beliefs and practices. Difficult decisions, whether to continue the pregnancy, seek medical interventions, or terminate the pregnancy. Each decision comes with its own emotional implications and moral considerations. Understanding the impact of cultural and religious beliefs on decision-making. Tailoring support to meet the diverse needs of families. Birth planning. Parents are encouraged to create birth plans that consider their preferences for labor, delivery, and postnatal care. This plan takes into account the baby's comfort, family bonding, and any religious or cultural practices. Comfort and dignity. After birth, the focus shifts to ensuring the baby's comfort and dignity. Pain management, soothing techniques, and minimizing invasive procedures are prioritized. Families are supported in making decisions about where the baby will pass away, whether at the hospital, at home, or in a hospice setting. These decisions are respected and guided by the family's wishes. A diagnosis of FFA can result in an intense grief reaction for the family, which can be relieved by adequate care and support. Bereavement support for healthcare providers is of paramount importance.
I wish for all pregnant women a healthy baby. Lara Ashraf.